IMA has played a pivotal role in the fight against COVID. COVID has now become an endemic, and we have to expect some ripples as the one we are witnessing now. So, in the country, we have an increase in the number of COVID cases, and Kerala, here we have realized that there is an increase in the number of COVID cases last month, and we have started doing genomic sequencing from November 2nd week onwards. And we have found some JN1 cases, and the first case was detected from a sample which was taken on November 18th. That was a sample of a 79-year-old lady, and she is now COVID negative, and she was in home isolation, and she's now perfectly all right. And later we have found 4 more cases, and there is, as you tell us, there is no need to worry about that. There is no need to create an unnecessary panic situation. But we have to expect this kind of ripples again and again. And thanks to the epidemic intelligence of the state, because this is the first case that we have detected. The 79-year-old lady sample was the first case in the country that was detected first in the country as JN1. And it may not be definitely the first case in the country, because data from Singapore airport surveillance activities tell us that the last few months they have done the surveillance and testing, and they have found 19 different cases from the samples of different passengers from different parts of the country. So I would like to thank all of you for the alertness and also the dedication that you all have in keeping the Kerala's health system like this. When you talk about Kerala's health system, it comprises of both the government system and the private system. So this was the case back in 2020, where we found the first COVID case in the country, and we found the first monkeypox case last year, and also the recent Nipah outbreak in Kozhikode. It was the vigil and the dedication of the health workers that helped us to find the Nipah case in the initial stage itself. And the field health workers, they have that suspicion in their mind in the initial stage, and they pass the message to the district surveillance officers, and the district surveillance officers asked to do the test for Nipah, and it was found as positive. At this point of time, when you observe the global scenario, we can see that the H5N1 cases in human beings are increasing, especially the news from Cambodia. Some 12 to 15 cases were identified this year itself. From 1997 onwards, we have so far found 800 cases. And this year, we have found that in more than 30 mammalian species, H5N1 was found, which poses a real threat. So all this information and all these data tell us that we have to be more focused on developing our policies, our programs, our projects based on One Health. As we all know, One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of human beings, animals, and environment. It recognizes the health of human beings, wild and domestic animals, and the entire environment, which includes the whole ecosystem, as closely linked and interdependent. By linking human beings, animals, and environment health, One Health can help to address the full spectrum of disease control, from prevention to detection, preparedness, response, and management, and contribute to global health security. As you all know, as we all know, One Health has got 2 important arms. One is definitely the zoonotic diseases, and the second one is antimicrobial resistance. Back in 1945, Sir Alexander Fleming had rightly said, while accepting the Nobel Prize, he has said then that one day will come when a common man can go to the medical shop or the pharmaceutical shop and he can buy penicillin by himself and he can administer it without knowing about it. Then there is a danger that the ignorant man can easily underdose himself and by exposing his microbes to non-lethal quantities of the drug make them resistant. WHO has already identified that AMR is a silent pandemic. So if things goes like this by 2050, you have to expect 1 crore people be killed because of AMR. So it's high time that we have already, Kerala had already formulated some concepts like antibiotic smart hospitals and antimicrobial resistance, and also we have created, we are trying to develop a society which is fully literate of the issue, an antibiotic literate state. Our aim is that, and we will be achieving this by 2024. And we have developed a surveillance net which is known as a CARSnet. And so far 40 major hospitals have come together to this network. And I'm very happy and proud that IMA, the leaders of IMA, the office bearers of IMA, or both the old office bearers and the new office bearers of the Kerala chapter, they are leading us in achieving our aim, and they have promised us they have the pivotal role, and they are bringing more hospitals to this CARSnet. So today I learned that more than 100 sessions are going to happen here in different conference halls. So I look at this conference as a very important one, where new ideas will be formed, new suggestions will be made that will help the governments formulate the health policies. When you talk about Kerala's health policy, we give due importance to healthcare. One example is that in 2016, the budgetary allocation for healthcare system or the health department was 665 crores. And now, this year, in 2023, the budgetary allocation for the healthcare system or the health department is through 2,850 crores. And beyond the budgetary allocation, we have developed a system called the KIFBI, where through which we are investing more on healthcare. And in the last 7.5 years, we have spent over 8,300 crores in healthcare system, not only in building up new infrastructure facilities, but also in developing robotic surgeries or like the new such systems. And also, when you talk about the free treatment that the government gives to the people, for the last 3 consecutive years, we are receiving award, or we are acknowledged by the Union government as a state which gives maximum treatment with maximum amount for free treatment for people. And also, as we all know, Kerala has got good health indices like ours. We have the lowest infant mortality rate, we have the lowest maternal mortality rate, our life expectancy is the highest, and this is not because of a work of 1 or 2 years, starting from the Renaissance period, the work, the dedicated and focused work of all the people, all the health professionals who had helped us in framing the policies, so we could achieve this. But here, the real challenge now we face is the lifestyle diseases. When you talk about COVID or when you talk about any such diseases, the main challenge is the population density of the state, and also the lifestyle diseases, and also the number of senior citizens in the country, because the life expectancy in the country is very high. So this year we have developed a special app called the Shaili app. In our mother tongue, Shaili means which is related to our lifestyle. So we have developed an app, and that app is called the Shaili app. And the field workers, our Ashas, will visit every household and they will collect the data. And all these data will be be analyzed and integrated by our doctors who are there in the Panchayat health centers, our family health centers, and all the risk factors will be analyzed. And all those who have the lifestyle diseases, we ensure that they take proper medication. And those who are at risk, we will tell them that, the doctors will tell them that you have all these kinds of risk and you have to change your lifestyle, you have to change your food habits, you have to start doing exercises, etc. So that kind of an intervention to improve the quality of life is, we have started such a program as a part of the mission which is called Arthur Mission, which is a dedicated mission for the health department of the state of Kerala. And I would like to acknowledge the contributions of IMA Kerala chapter. I know from my colleagues that IMA Kerala chapter has got a major role in the nation, in the country, in framing and influencing the policies of IMA nationwide. And also I would like to acknowledge the efforts taken by IMA in waste management, bio-waste management, and also in educational process, because last year we were having that more number of cases in influenza, you may be remembering. So that was first of its kind, and all of us, that the doctors, or all of you sat together, discussed about this, and all the government hospitals, private hospitals, all the doctors had meetings online and offline, and we could develop a draft, a guideline on how to deal with the situation, influenza among children. So it's with the cooperation of IMA and the members that Kerala State, the government of Kerala, the health department is moving forward in achieving our goals. Once again, I would like to thank all of you, and also especially IMA Kerala chapter, and also I would like to congratulate Kerala chapter and also IMA for organizing such a wonderful program. And I wish all of you a very fruitful, prosperous and happy New Year. Thank you very much. And with these words, I would like to inaugurate the academic sessions of this 98th National Medical Conference. Thank you very much.